Colon cancer is among the top 10. I think it is taking 6th position. Colon cancer is a tumor or a growth of the large intestines, which are part of the digestive tract. And when the cancer starts, we have abnormal multiplication of cells, and these cells will eventually form a tumor or a mass that can cause blockage to the intestines, or it can cause pain. Actually, colon cancer symptoms take time. In fact, many patients, if you ask them, they will tell you, yeah, I've had constipation, sometimes diarrhea, bloating, stomach upset for some time, even a year, before they are diagnosed to have cancer. So if you will encourage people that if you have what we call altered bowel movement, like your normal stool habit is, something has changed, even the color of your stool, or you are getting constipated, alternating with diarrhea, gas in the stomach, is good to check that for screening for colon cancer. In early stage, there will be those symptoms we've mentioned, but with the advancing stage, you will come with total blockage. You are unable to pass stool, so we call it intestinal obstruction. Patients can also have weight loss, lack of appetite, tiredness, and if there's bleeding, then the patient becomes anemic. The other symptoms depend on where the cancer has spread to. If it has spread to the liver, you'll have abdominal pain, yellowness of the eyes. If it has gone in the lung, you'll have chest pain, sometimes difficulties in breathing. Majority of the colon cancers, no one knows the cause, but there are few risk factors which come into play, like a genetic predisposition. If you have a family history of cancer, there's a chance one can get colon cancer. The other risk factor is a lot of processed meats. If you use or canned meats, it is not good to use them for a long time. Excessive use of fat is not good. Lack of exercise can also contribute, and use of tobacco and alcohol to excess, it's not good. Cancer treatment of the colon for colon cancer depends on the stage. The primary treatment usually is operation or surgery to remove the tumor. That is possible especially in early stage. In late stage, then when the cancer has spread, then surgery sometimes may not be offered, and the patient is advised to get chemotherapy and radiotherapy depending on the location of the tumor. And there's a lot of research that is going into colon cancer, and we have a lot of targeted therapy and promising targeted treatments that are in the horizon. They are just under research. And if a patient also presents with pain, there's also general management of the symptoms around you. So if you have pain, you get painkillers. If you have obstruction, then the doctor have to see how to relieve the obstruction. And sometimes you are given what is called a colostomy to divert the stool as you continue with the cancer treatment. So when palliative care actually in cancer, there is a push that it should be started early. And palliative care doesn't always mean that it's end of life care. There are many things that go into palliative care. Even chemotherapy, when the cancer is advanced, the doctor will tell you they are giving you the chemo as a palliative treatment without intention to cure. Radiation can also be used. Pain control is part of palliative care, counseling, nutrition support, and patients are encouraged to go through all these processes at an early stage. They are sensitized about them as they enter into treatment. But towards the end of life care, also palliative care comes out very strongly And there's an option of no active oncological care like chemo, radio, or surgery, and you are just advised to get painkillers and manage at home the symptoms as they come. In terms of palliative care, really, as I said, patients are encouraged to go through it. It doesn't mean you are dying tomorrow. It's not equivalent to end of life care. Palliative care can cut across, and it involves many things, and one should not shy away. In fact, palliative care, if started early, improves the quality of life of the patient. When you come to the symptoms of colon cancer, they actually mimic other illnesses of the digestive tract. You may just be having indigestion, but the symptoms are similar to colon cancer. It could be hemorrhoids, which are very common in our society, and the symptoms look like colon cancer. You have blood in stool, pain on defecation, constipation, sometimes diarrhea. So it is not always that these symptoms are pathognomic of cancer, but they could also just be other diseases. So the only way is the doctor to examine and exclude cancer. And if it's just normal issues like constipation, okay, you go to the chemist, you buy medication, and you relieve yourself. But if it keeps recurring, and then it's associated with pain on defecation, blood in stool, weight loss, it is good to think beyond the box and just have screening for colon cancer. For colon cancer, one is the history, physical examination is good to go through a doctor. And then for the testing, it's a planned test. So we can take your stool and just check for what we call occult blood. So it's a simple blood stool test. We look for the blood in the stool. If that test is positive, then the doctor will tell you you need to go for endoscopy, whereby they look inside the colon with a camera or colonoscopy. Beyond that, then the doctor can escalate the test to CT scan, MRI, X-ray, depending on their findings. And if you have a very strong family history of colon cancer, then we encourage that the family members go for early screening. From age of 40, you already been done screening. Majority of the patients are actually above 40 years, but we still do have younger patients getting colon cancer, especially if it is like maybe genetic, you inherit some bad genes, and for strange reason they undergo mutation and the cancer starts forming. So it is possible it can occur both in the young and in the old, whether you are black or white. Food, especially they are talking about excessive use of canned meat, red meat, all those should be used to moderation. But there are those genetic things that we cannot do anything about. As we grow older also, we are at risk of getting any cancer, whether it's colon or anywhere else, which you may not be able to avoid. Okay, really one needs to eat a balanced diet. Patients are encouraged to, they can eat anything, but to moderation. There is, I would say, there are a lot of myths and misconceptions out there. Patients are told a lot of information, and you have to sieve and decide what you will take in and what you will not take in. But at the end of the day, one needs to stay healthy, to have a strong immunity to fight the cancer itself. So a balanced diet comes into play. But if in doubt, always we have people to help in diet. We have nutritionists, dietitians who are trained to take care of those nutritional needs of a cancer patient who has colon cancer. Majority of the cancer patients are actually being treated locally. Very few are flying out of the country, and those who can afford. At the end of the day, a patient has a right to be treated where they wish to be treated, so long as they can afford it. But as a doctor, we will sit with the patient, give advice on the treatment that's available in the country and what is not available in the country. So if as a panel or as a multidisciplinary committee of doctors, you based on the evidence that is available on the research that this treatment is available in the country, then we'll encourage the patient to get treatment locally. And we do have hospitals in the country, county hospitals. In Nairobi also there are hospitals which can manage cancer locally. And for example, let's pick surgery. Surgery can be done in a county hospital, you know. So you don't have to fly to overseas or India for a surgical procedure. Chemotherapy can be done in the county, so you don't have to fly. And the drugs actually we are importing from India. In fact, Kenya is the biggest importer of cancer medicine from India. So you know these drugs we are getting from there. So they can still get the same drugs back home and at the comfort of their home country with the family support, you know. But there are few cancers that cannot be managed locally, and we'll tell the patient, for example, you need a bone marrow transplant. If it's not available, we'll advise really you need to go, and we'll refer the patient. So some of them are just misinformed about the treatment that's available locally, and some are in denial, so they just think there's a miracle cure out there. But at the end of the day, the doctor treats and God heals. So wherever you go, no doctor can give you any guarantees, but they will treat you using the best available evidence of the treatment that works. And there are some type of cancers which are very aggressive. Whether you get treatment at home or overseas, you find there's no response to the treatment, and that's just how nature is. But there are those who do really respond well back here home, or even when they fly outside, they still get very good response to treatment. So it's about nature and balance. But our doctors in the country are well educated. Our universities are investing a lot in teaching, in research, and we hope the future is actually going to be better than what we see now. I think there's public-private partnership. The private hospitals complement the public. And also the government has done a lot in terms of, you know, the universities, they are government-owned, and they are training doctors, they are training nurses, they are training radiotherapists, you know, there's a lot, medical oncologists, radiation oncologists. Training is now available locally. They are training clinic officers. So in terms of education, our government has tried. We come to in terms of treatment. We formulated the cancer treatment guidelines, which are going to be disseminated and enforced into the counties so that people look out what cancers should we treat, how do we treat it, at what level can this cancer be treated, and at what time should we escalate to the next level of hospitals. So all those are in place. We have the National Cancer Screening Guidelines that just guide which cancers should be screened for and what should be done, even in the mashinani, to counter this menace. NHIF has also come in a big way to offer oncology packages to cancer patients. They can now have surgery using NHIF in a public hospital, and you don't have to top up anything. For example, they can get chemotherapy, they can get radiotherapy. So it's a big relief to families. We also have a political will. Our president put health in the Big Four agenda, and in there we have UHC. And UHC, we also, as oncologists, want to realign with UHC. What can we do for the Wanjiko in the mashinani to learn about UHC? There's a lot of panic because of the passing away of the dignitary people, but really we are telling the members of the public to be calm, that all is not lost, and there's always hope. And there's something that can be done even at the county level to fight cancer. And let's not feel like, okay, this burden is only Kenya. Actually, even America is struggling with cancer. India is struggling with cancer. In fact, when you look at the statistics, you'll be you'll actually see that the death rate in India on cancer, like cancer is the third, fourth leading cause of death in India itself. Just like in Kenya, it's the third leading cause of death. So it is, cancer is a global problem, and it's just not in Kenya. But there's just the hype because of the dignitaries who passed on, but it's affecting people every day. And we all now have to be aware and go for checkup, go for early treatment, not hiding, trying to create awareness about it. Where can one seek treatment? As a nation, we need to come together and talk to people through media, through churches, schools. Let them be aware of the common types of cancer. What are the symptoms? How can you get treatment if you have it? And if you don't have cancer, what are the preventive measures you can do? Simple little things. For example, avoiding use of tobacco, alcohol. It can reduce your chances of getting cancer. Immunizing our children against HPV HPV virus by using HPV vaccination can help the young girls in future when they grow to or adulthood, they don't get cervical cancer. Hepatitis B can be given in the community level in the spirit of fighting cancer. People should reduce the use of mirror, okay, because mirror has been linked to throat cancer or esophagus cancer. In Bomet County, we also see a lot of esophagus cancer. People link it to mursik, or probably there's something they mix in mursik that makes them at more risk, or it could be the hot beverages that people are drinking, or the pesticides. So all these factors come into play. So you are advised not to take hot beverages. Just let it cool a bit before you drink, so that you don't irritate your throat. Exercising, trying to walk, trying to keep healthy, it is good. Because in Kenya, if we look at the big killers, actually number one are the infections, general infections, malaria, typhoid, HIV, pneumonias, and so on. This is followed by heart diseases. So we need to check out, do we have blood pressure? Just go for checking of blood pressure, because that could save your life, because blood pressure is the second killer. Then cancer is like the third. So we need to be aware of all these things. When you go to hospital, don't just go for cancer screening. Go for checking of your pressure, your blood sugar, depending on the age that you are. Get screened for infections. And with all this, we'll have a healthy Kenya, healthy community, and we will be able to build our country to the next level. As Kenya in the East African region, we have actually taken lead to the rest of the East Africa in terms of cancer treatment, cancer research, and even education. We are key. And World Health Organization, through International Atomic Energy Agency, have designated Kenyatta National Hospital as a regional center of training. So we are going to train doctors for the region just to manage cancer. And for the government, I think we need to support it, implement the UHC. People can go to the counties and get free cancer screening, even basic cancer care at that level. And only those who need specialized attention should come to the tertiary level for treatment. Also encouraging people to register for NHIF. You don't wait when you are sick. We need more people, more masses registering for NHIF. And this will cushion those who fall sick. They have access to timely and quality health care. And we focus more also on prevention. you.